So a little bit of housekeeping. I was going to tell you who I am, first of all. So I'm Professor Alan Thornhill. I'm a fertility expert with over 25 years of experience and more than 100 scientific publications in IVF. Specifically, I'm a clinical scientist specializing in embryology and genetics. I've worked in IVF and diagnostic laboratories, research, clinical and business management, and I've even worked with the UK's fertility regulator, which might be relevant tonight when we get to the questions and answers part. I've worked in the US and UK-based IVF clinics, and I'm involved in the IVF journeys of thousands of couples. And so while I work in the biotech industry right now, I've got this sort of personal mission to try and use what I've learned in a unique brand of fertility coaching. And we'll hear more about that after the webinar finished today. Speaking of questions and answers, during the webinar or at the end, you can put in the chat any questions you might have, and we will try and answer them. Now, today, unfortunately, Dr. Yana, who's from the Unica Clinic, as well as Nathan, she's unable to attend. So if you've got any specific medical questions, feel free to put them in the chat, but they won't be answered live today. We'll forward them on to the clinic so we can get you a good medical answer for that. Also, if you have any technical problems, please put that in the chat as well. I won't be helping you with that, but our helpful little elf in the background will help if you have any technical issues. So that can be anything from not hearing us, not being able to write a question, anything like that. Now I've spoken enough, and now I'm going to introduce our speaker today, who is Nathan Billings. He's a holistic fertility acupuncture specialist working at the Unica Clinic in Prague, in the Czech Republic. He's from the US, where he got his master's degree in acupuncture, and he's been living in Prague for over 3 years, where he's working with that clinic, offering acupuncture to fertility patients. The Unica team is very happy to have an American acupuncturist in its team because acupuncture for fertility has been prevalent in the US for a lot longer than in Europe. So without further ado, I'll hand over to Nathan. I'll go off camera and we'll listen to him and we'll have questions at the end. So thanks very much.
Great. Well, thank you, Professor. Hello, everyone. My name is Nathan, and like the professor said, I do acupuncture at Unica Clinic in Prague. I grew up in the United States and did my training in Chinese medicine in Seattle, graduated in 2010. In the US, Chinese medicine requires a master's degree, which is a full-time 3 or 4 year program that includes hundreds of hours of classroom and clinic time. I moved to Europe in 2015 and have been living in Prague since 2018, for which I'm very much grateful. So on today's agenda, a second here as I go through. So on today's agenda, I thought I'd first give a brief primer on acupuncture and Chinese medicine to give you a sense of how acupuncturists approach treatment. This may be redundant for some of you if you're more familiar with Chinese medicine, but I'm hoping it's interesting for the majority of you. Next, I'll briefly talk about Chinese medicine and how it has traditionally treated fertility and other gynecological issues. And finally, we'll go over how acupuncture fits in with modern IVF treatments. Let's see, one sec. Sorry, I'm going back and forth between my notes and the thing here. All right. So acupuncture is one modality in the much larger system of Chinese medicine. Chinese medicine is a large, complex system of healthcare that encompasses acupuncture, Chinese herbs, massage, cupping, diet, and other modalities. So Chinese herbs are kind of interesting because they're always used in, like, to make a formula, you need 2 or more herbs, and there are hundreds of herbs, and they're combined, they're mixed and matched in different ways to create the different formulas, as opposed to usually in the West, it's sort of single-use herbs, St. John's wort or whatever it is. Massage, that's pretty self-explanatory. Cupping, we've probably seen that more lately. A lot of the Olympians, you'll see the circles on them. That's basically a cup that has a, you'll create a vacuum in the cup and then place the cup on the skin. So you'll maybe get a red mark or sometimes a bruise. It helps bring blood and fluids to the surface. Diet is a big part of Chinese medicine. They have very particular ideas on diets and how diet can affect different body types, different diseases. And there are other modalities as well. Gua sha, if there's a scraping technique that can be used. I think maybe certain chiropractors have started doing that more nowadays. Anyway, there are a few other things that are included under the umbrella of Chinese medicine. So acupuncture is, sorry, 1 second here, let me make sure I'm all set. Okay. So acupuncture is among the oldest healing practices in the world, dating back 2,500 years, and has been refined and improved over that period. There are different styles of acupuncture, including Chinese, Korean, Japanese, but I practice in the Chinese tradition. And so now I'll give a brief overview of Chinese medicine. I hope it's helpful or interesting. So in Chinese medicine, there are 14 primary channels, sometimes called meridians, that span the body. There are three on the inside of the arm, 3 on the outside of the arm, and then 3 on the inside of the leg and 3 on the outside of the leg. So that's 12. I said there were 14. There's also 1 that goes down our midline in the front and 1 that goes down the midline on our back. There are the main channels I mentioned, but they aren't just distinct channels that do not communicate with each other. They're all connected with each other. So it's really more useful to think about them as a grid that spans the whole body. Kind of like with this picture here, you can kind of see yeah. So each of the channels correspond with a different organ. Well, actually, each of the first 12 channels corresponds with a different organ. The channels extend externally on the limbs and also go interior in the body, connecting the corresponding organ with the channel as a whole. Each of the organ has its own set of functions, like in Western medicine, that help the body function in a healthy way. But from a Chinese medicine perspective, some of the organs have functions similar to our scientific understanding of organs, but some are unique to Chinese medicine. Each of the organs has a different relationship with each of the other organs, and these relationships are what keep the balance in the overall system. The goal with Chinese medicine is to find balance so that we can be healthy. Too much or too little of something can throw the system out of balance, and that's when we experience unhealthy symptoms. This imbalance leads to a blockage in the flow of qi along the channels and meridians, and qi can be unblocked, according to Chinese medicine, by using acupuncture at certain points along these channels. And the following terms, the yin and yang, and the hot and cold, and qi excess, you've probably heard of yin and yang. It can be seen as a part of a continuum, not two defined things, not two separate things, but sort of a spectrum that goes back and forth. And I'm not actually going to talk about yin and yang. It's a pretty large subject, but I think most people understand the idea of the need for harmony in the system between the different extremes or the different parts. Hot and cold is actually also a part of yin and yang, but we also are looking for signs of hot or heat and cold in the body, which can help us determine a course of treatment. Qi in excess, or if it's deficient, qi is obviously another big subject related to the previous two, but simply put, it's the body's energy. We want the right amount of it to maintain good health. Now, when you are visiting an acupuncturist, just to kind of give you an idea of what it's like if you've not been to one, if you're visiting an acupuncturist to diagnose your particular condition, they will ask about symptoms you're experiencing, as well as questions about overall health and lifestyle. They will look at your tongue and feel the pulse on both arms. Both the tongue and the pulse can give us information about the organs and about general health. Many acupuncturists will palpate the body along the channels to give them an idea of where to insert the needles. We are looking for patterns of symptoms, which then give us a diagnosis on which we can base a treatment. In Chinese medicine, it's all about the pattern for an individual person, then treating based on that pattern. When the needles are inserted, I need a drink of water. When the needles are inserted, they're typically retained for 20 to 30 minutes, maybe more. And the needles, actually, I meant to grab a needle so I could actually show you how small it is. But needles are a thin piece of metal. They're solid. They're not hollow. They are so thin that dozens of them could fit into a syringe or a hypodermic needle. They're completely sterile. They are used only once, and then they're disposed of. They are perfectly safe, assuming you have a qualified acupuncturist using them. Many people want to know if acupuncture is painful. The short answer is no, it is not painful. Here's what I tell the clients before a session. I always say, after I insert the needle, you may feel a pressure at the point. You may feel hot or cold sensation. If any of the needles are uncomfortable, just tell me and I'll change it. It's all about communication. Sometimes you might feel uncomfortable for just a moment, but you can quickly adjust it, and it's a very relaxing and pleasant process. And so the doctor isn't here, but when I do acupuncture at Unica, they will, schedule it, well ahead of time so that I'm there and ready to go before they come. We'll do the acupuncture session for 20, 25 minutes, and I'll play some pleasant music. I'll have the client focus on their breath and just kind of settle in. Shortly after that, the client can then go straight to their embryo transfer, because I do it on site. And then after the embryo transfer, we'll have another session and everyone will go on their way. It's nice because I get to see people kind of visibly change, become more relaxed and less stressed. And so Chinese medicine and overall fertility. Chinese medicine has been used for thousands of years for women's healthcare and for fertility. Depending on what the issue is, Chinese medicine can treat many of the causes of infertility, but not necessarily if there's a physical blockage. In Chinese medicine, the first rule is that we try to regulate the cycle if it's irregular in any way. So what does this mean? If the cycle is too short or too long, if the period is too heavy or the period is too light, if there's spotting before the period or ovulation, if there are premenstrual symptoms, etc. And acupuncture will have a particular treatment during the follicular phase, a different one in the ovulation phase, and another during the luteal phase. And we would typically not treat during menstruation, though with some symptoms we might. These treatments would also be combined, most likely be combined with Chinese herbs. Chinese herbs are a big part of Chinese medicine, gynecology. So it might just be acupuncture, but you might be asked to take a herbal formula as well. And we must also consider tongue-tied. I'm a little cold in my room here, so I apologize with the heat so low. We also must also consider any underlying medical conditions that the client has been diagnosed with. These might be thyroid issues, uterine fibroids, endometriosis, PCOS, although those last two can be a little more difficult with Chinese medicine. And also the treating men. In 1/3 of infertile couples, the issue is with the man. So if part of the issue with a couple's fertility is with the man, then he should also seek out an acupuncturist. They will treat him with the hopes of increasing sperm quality and motility. Stress has been shown to be a factor in male infertility, so we know that acupuncture affects endogenous opioids and neurotransmitters, serotonin and dopamine. Acupuncture treatments over time can help stress levels by treating those, by sort of igniting the opioids and the neurotransmitters. Male infertility and acupuncture have not been studied much, but I've seen one small study that shows positive results, but much more is needed to confirm these results. And so, I'll move my slide here. Yes. So, what are the ways that acupuncture can affect fertility? Blood flow to the reproductive organs. Acupuncture regulates uterine and ovarian blood flow, which leads to a thicker uterine wall, so fertility is improved through embryo implantation being more successful. Endorphins. Acupuncture impacts beta endorphin levels and thus hypothalamic function. which affects the gonadotropin releasing hormone secretion and the menstrual cycle. So that's one way we believe that acupuncture may positively influence ovulation and fertility. Acupuncture's effect on endorphin levels and their analgesic effects have also been studied, which can help with menstrual pain, among other things. Neurotransmitters. Acupuncture can affect neurotransmitters, serotonin and dopamine. I've just mentioned that, which also lead to analgesia, sedation, and to recovery of motor function, which can also help with menstrual pain. And blood sugar metabolism and insulin resistance. Acupuncture has been shown to decrease blood sugar levels and decrease insulin resistance, which can be particularly useful in PCOS. So overall, with acupuncture, we're trying to regulate the hormones, increase uterine and ovarian blood flow, decrease stress, and treat other underlying conditions that may affect fertility. And so acupuncture benefits with IVF in particular. I mean, all those other, the things I just mentioned are very much related to IVF. But specifically, there have been very positive studies and meta-studies that show increases for success for clients that do a before and after treatment on the day of embryo transfer, particularly women with a lower chance of success, women that have not previously succeeded with IVF, and women over the age of 36. Now, there are a handful of studies that say it doesn't help, and it says they don't hurt, but it says that the results aren't distinguishable from sham acupuncture. And sham acupuncture is actually kind of a controversial, hotly debated topic because sham acupuncture may not be completely inert, and there are different types of sham acupuncture. Anyway, it's kind of we won't talk about that. But anyway, there are just a handful of studies that just say nothing. But the kind of differences amongst these results, there are a few reasons we might see differences in results from different studies. And first of all, different studies use different acupuncture points. So that could be an issue. Second, in different studies, various methodologies are used. And sometimes in studies, non-acupuncturists are used to insert the needles, which seems a little odd to me. But we know that acupuncture does reduce stress. IVF can be a very stressful process, particularly like when in the Czech Republic, most of the clients at Unica are traveling. And so the process as a whole is stressful for the couples. And then with the travel, it's also doubly stressful. So it can be very useful for that. And there's one great study that it wasn't looking at IVF success or failure. It was just looking at stress and acupuncture and IVF. And that very, very clearly showed that the women were much less stressed out and they had a more positive outlook during the process. So, and then we'll move our slide here. And so what are the ideal amount of treatments, like the amount of acupuncture sessions? There's no consensus on the optimal treatments needed. I suspect it's different for different people, like many things. The majority of women doing acupuncture with IVF will only have the acupuncture on the day of embryo transfer. And as I mentioned moments ago, there is good evidence to show this increases success. But there's also, I mean, I've just seen the one actually, but it had a pretty large cohort, and it was a much longer study. So there's one great study that showed an improved odds of success with treatments starting 3 months before suppression. So that would be 12 or more treatments for the prior 3 months. And I have to say, I think this is probably ideal. Again, these things need to be studied more. We don't have an exact amount of treatments, but I think it's probably ideal for the most success. But also, you have to understand this is a much bigger commitment. So that's something to take into account. So let me make sure that I got everything, but I'm pretty sure that we will move on to questions. I know we don't have Dr. Yana. Oh, you know what? I'm sorry, I might have skipped something. Nope, I didn't. Sorry. Sorry, y'all. I'm looking at my notes and I want to make sure that I had this right. Okay. Well, I guess we'll just wrap it up. I want to thank you all for being here. And it looks like we're going to take some questions. And I guess I'll throw it back to the professor.
Hi, thanks, Nathan. Yeah, I've learned a lot today, so that's good. That's always a good thing. And I've got loads of questions too. But the good news is our lovely audience have some questions as well. So I'm just going to go to the question page so we can see the question. Let's see. Sorry, this is all new to me. So you did answer this one already. You did already answer the question about does it hurt?
Yes.
Yeah, but Vicky's asked the question, does it hurt? And maybe you can go into a little more detail about that.
Almost everyone finds it not just not painful, but very enjoyable. Like I mentioned, it's been very well established that you get this endorphin effect from acupuncture. So sometimes we call it sort of an acu-high. You feel kind of very pleasantly out of it. There are veins and tendons and things like that you have to watch out for in the body. So, but like I said, if anyone's uncomfortable, you just change the position of the needle very quickly, and it's all very fine. So anyway, I hope that's helpful, but yeah, it's a very relaxing, pleasurable process.
Yeah, which I'm not going to try and what do you call it, hijack the questions. It's just that I think maybe we can reframe them sometimes. So
okay.
You said a couple of things about, and correct me if I'm wrong, but you said, you have to understand a pattern and a diagnosis. And it's not particularly generic. It can be quite personalized. And
Yes.
I guess when we talk about whether something hurts or not, that can be quite a personal thing, right? People have different view of pain. And as you said,
right.
if it's, you may have to learn how to do it well in one particular person and get the right spots. Is that fair?
That's totally fair. Yeah. Some people are more needle sensitive. And so you might needle them. Maybe you might not needle them as deeply than other people. Other people are needle sensitive at all. And maybe you can go a little deeper. Other people are just a little jumpy at first and they just need to get used to the process. And what else did you mention? But you're absolutely right. That's also an individual thing.
No, that's good, and it'll relate to another question I ask later, which kind of you can up level it to almost all of IVF. It's to do with let's say these things work, and I'm quite skeptical. I'm a scientist, so I'm always very skeptical about the evidence. I'm not saying it doesn't work, by the way. I'm just saying I go into it with a very sort of skeptical view. But let's just say that it works for the sake of argument. I would say that it doesn't matter what treatment we're offering, it's got to be done properly. And I think that's come through in your talk and I think this relates to another question that we have from the audience that can anyone do this? Is this just sticking needles in people, or is it a little more complex than that?
Well, I tend to think it's more complex than that. I tend to think that the who's putting them in and the channels you're putting them into matter. And that's sort of what they're testing with the sham acupuncture to show if, if it matters at all. And I think it does. But, these are the things like, how do you get a proper sham needle that doesn't insert it? I don't know, because even if you're putting a sham needle in on the surface on a channel, you're still at an acupuncture point on the channel. So that's why things get a little complicated with testing for the sham. I mean, to my mind, there should always be a control group that has nothing, a sham, and an acupuncturist putting in real needles. But that's not the way it's always handled. But
so this, thank you. That's really helpful. So this was a specific question from Liz, which relates to what I kind of said in a more generic way. Can a naturopathic doctor do it as well as an acupuncturist?
Some naturopaths are, I mean, that term naturopathic doctor kind of varies from country to country, that term. So the training in the US might be different than the training in the UK or continental Europe. I know some naturopaths in the US are highly trained in acupuncture. But some people will just get a weekend course, like a chiropractor or something will get a weekend course. And well, see, I don't want to slam on chiropractors, but a lot of times if you hear something in the news and it's a problem with acupuncture, it wasn't an acupuncturist doing it. It was somebody with needles that was not an acupuncturist. So the short answer is a naturopathic doctor may be able to very effectively put needles in, assuming they have the proper training. I just wouldn't be able to determine whether that, is blanket from country to country.
I think the key phrase there, with the proper training, right? I mean, it doesn't matter what you call yourself, what badge you have. If you haven't been trained to do it, there's a chance you might not do it right. Is that fair?
Absolutely. Yeah. Okay. You need to stick in. Yeah. You gotta stick a lot of needles in before you're, and hopefully with your classmates before they set you on the general public.
Okay, so now we've got to, I think, again, you may have answered this, but sometimes things are really worth repeating. How many times and how long should one have acupuncture before fertility treatment? For example, IVF.
Yes. As I mentioned, the majority of women, that I'm seeing, they're just doing acupuncture before and after transfer, on the day of transfer. And there are good studies to show that is beneficial, that it increases your odds. Like I mentioned before, I suspect more is better. And if you were to do it for 3 months before suppression, that would probably be ideal, 12 or more sessions. But again, coming up with an exact dosage is, not an exact science, if you will.
Yeah, and again, I'm just being fair from a scientific and published paper point of view. As you will know, there are many publications and there are quite a few meta-analyses, as you referred to. There's not a consensus. I think it's fair to say that it's not a consensus. Now, I offer certain treatments through, the work that I've done through my career. I'm not going to say what they are because I don't want to hijack the session, but not everybody believes they work because not all the evidence is in the same direction. So I think it's fair to say, it would be a wonderful world where every treatment we offer, every single publication, every study always says that it works, but that's not the real world. As you know, the real world is some things work with certain populations. Sometimes they work, sometimes they don't. And you get a bit of a mixed picture. And so you end up being able to say something like, well, it doesn't do harm. It definitely relaxes people. And you're able to sort of say the positives. And I think you've done that really well. Vicky's got some other good questions, and I think they can be kind of coupled together because they might be related. She asks, is there anybody who shouldn't have acupuncture? And another question, she says, can you have it once you get pregnant? So because I don't know the answer, I'm wondering whether those two things are mutually exclusive. So can you think of people in this we're talking about fertility patients, obviously, who shouldn't have it. And if you do get pregnant, should you be having it then?
People that shouldn't be doing it. I mean, some people are just too jumpy or too needle sensitive. It's not going to be for any, like most people find it extremely relaxing. Other people, the idea of sitting in it, calmly on a table for a half an hour with needles in them would just give them too much anxiety. So, most people find it very relaxing, but clearly it's not going to be for everyone, just from an enjoyment level. And as you mentioned, it's very possible that some people just respond better than other people, and maybe some people don't respond at all. And oh shoot, I'm sorry. What was the?
Well, I'll ask you the other question in a second. So again, an easy one: is it okay to have it if there's an indication once you're pregnant? If you get pregnant.
Absolutely, yeah, absolutely. There are certain acupuncture points that are contraindicated. We do not use them when someone's pregnant, particularly in the first trimester. But it's completely safe throughout pregnancy. Again, assuming you have someone qualified to do the acupuncture and they know the points to not do and the points to support you with where you are.
Okay, perfect. I've got a question about Chinese herbs. There's a couple of different ones. I think this one's the sort of longer version. I'll read the shorter version as well, just to make sure it's kind of asking the same thing so we can double up. And it's saying, is there a risk of using Chinese herbs during IVF? Well, this one, it's quite a lot of detail about how somebody's been having acupuncture, but then it's, focusing on the whole body. But then it says, I get worried about taking herbs whilst doing transfer. So is there anything you can say about the herbs in a generic way?
Herbs, you're talking like after she's started the drugs?
Well, this one says, I get worried about taking herbs whilst doing transfer.
Okay.
I guess they're quite complex questions, really, because, it's not generic, as you said. It's quite sort of personalized, isn't it?
And I'm just going to talk me personally, and this maybe other acupuncturists with different experiences would answer differently. I wouldn't do herbs after the drugs have been administered. Once the doctors have taken over, I would stick with the acupuncture, but that's just me.
Okay, and that relates to a question.
And that doesn't mean that doesn't mean it's harmful or a problem necessarily. But just for me, I wouldn't. But if it doesn't necessarily mean it's a problem.
Yeah, no, I understand. And I suppose my up-leveled part of those sort of questions is, when you gave your talk, it was more than just acupuncture. Is it worth doing before and after the embryo transfer? And I was aware that there was evidence for doing it other times to try and, improve, retrieving eggs, or lots of different parts of the cycle. My sort of question, I suppose it's similar to those concerns from those people, is that Chinese medicine clearly could be used throughout the fertility cycle, throughout the IVF cycle and the fertility, the menstrual cycle. But once you introduce sort of Western medicine, is it okay to mix and match? Because in a sense, that's what we're doing, isn't it? If we use stimulation drugs and other drugs that are part of a normal IVF cycle, whether that's good or bad, I'm not judging that. Once you start introducing Chinese medicine as well with herbs, is there a danger, probably maybe that's too strong a word, that they're kind of not harmful, but they're kind of competing against each other in some way?
Well, and that's for that very reason. That's exactly why I would discontinue herbs when the Western medicine has been introduced. Like I said, acupuncture and very much herbs regulating the cycle beforehand and getting that more regular and healthy, I think is very important. But as I mentioned, I personally, once the suppression started, I wouldn't continue with the herbs. Again, they may not be a problem at all. I just, once the doctors take over, for that part of it, I don't want to, I only want to help and make absolutely certain that I'm not getting in the way.
No, that's
it's just out of abundance of caution.
Yeah, no, and I think that's a very reasonable thing to say. And, you know, I'm not an expert in acupuncture and I'm not a medical doctor, but I would say this, you know, when you get treated for anything and you get given a series of drugs, there's always drugs that you're not allowed to take at the same time, right? That's a, you know, a common thing. So I think that's important for people listening to this talk, again, to not to make it about necessarily acupuncture, but whenever there's potentially conflicting medicines, you should ask and be careful. You shouldn't assume that they're sort of additive or complementary. They may be, you know, in conflict with each other. And so you're taking the conservative approach. Why would I, you know, given that somebody has decided they're going to use these drugs to stimulate the ovaries to produce eggs, I'm not going to try and interfere with that because that's already proven that that works, right? I mean, we know we can get eggs by stimulating ovaries.
That's exactly right.
Okay.
You guys know what you're doing on that side, and things are in motion, and I don't want to impede that.
Speaking of drugs, because I am a Luddite when it comes to this, I'm guessing this is a drug, but I don't know. Does this mean anything to you, or should this be one for Dr. Yana and the team at Unica?
No, this is my side.
Good.
So Moxibustion is also, it's one of the modalities I didn't mention. It's the herb mugwort, and it's used quite a bit in Chinese medicine, and it's burned. It's used, there's different forms of it. Sometimes it's kind of packed into like a cigar type shape, and you can kind of warm the skin with it. Sometimes we'll put it on the end of a needle and literally light it on fire, and it'll kind of stimulate along with the acupuncture needle. It will warm that point. It's actually feels great. And then there are other forms of it as well. Moxibustion, absolutely, under certain circumstances, is great for fertility. It depends on the pattern for the, you know, as I mentioned, we kind of put, whether it's fertility or any issue, we put things into different patterns. And for certain patterns, absolutely, Moxibustion can be used along with acupuncture. So it's not, typically you would use Moxibustion with acupuncture or acupuncture. It's not like an either or with Moxibustion and acupuncture.
Okay, fantastic. Well, I've learned something there. These questions are great, guys. So keep them coming if you've still got more. This one I want to show because if you'll permit me, after you've answered your bit, I've definitely got something to contribute because I want people to understand there's more components to this issue than just acupuncture. So here's another great question from Vicky. Can acupuncture help women who've had previous failed embryo transfers? So they've had a series of transfers and they've been unsuccessful. And I guess the question is, can you still use acupuncture, but also would it maybe be even more useful?
Well, I mean, as we've discussed, I'm hoping the studies are correct that show that women that have had trouble before would have an increased odds of getting pregnant or having successful pregnancy and live birth. So it's certainly safe for these women to do it. And yes, I mean, I would encourage it. Again, the studies aren't a slam dunk, so I can't say without with certitude that it's going to help, you know, any individual person.
Okay, lovely. Good. That's really balanced, and I appreciate that. So the only thing I wanted to add was not to promote the things that I've been doing my whole career, but just to say the other factors you have to consider when you've had a failed embryo transfer. Well, for starters, and I mean this it's going to sound blunt and brutal, but that's how I roll. If you've got to an embryo transfer, you're already quite successful. You've produced an embryo. It's good enough quality to be considered for transfer. So this is good. but there's still a barrier to get over. Obviously, the embryo's got to implant. So acupuncture might help with that. That's what we've heard about today. But you've got to remember also the embryo quality needs to be good enough. And the quality comes in 2 different flavors. Are you chromosomally normal? I see one of the questions in the chat is about testing the embryos for genetic abnormalities. Well, that's one element. And also just stuff we don't yet understand. Is the embryo intrinsically good enough to keep developing an implant and produce a baby? So there's the embryo. And then the other side is, what's the environment that it's going to grow in, the endometrium? So, I think you have to, think of it in a sort of holistic way. There's several or multiple components that you have to think about. So if you've had a previous failed embryo transfer, there could be lots of things that are not quite right. And until you've ruled out those particular other issues, you can't really pin it on one thing. So I guess, again, let's play that thought experiment and say acupuncture definitely works. We don't have evidence to say it definitely does in all cases for all patients, but let's pretend it does. But if we have a poor quality embryo, there's no acupuncture is going to help you implant that embryo because it's not good enough to implant. So I don't want people to come away from any of these talks thinking there's one sort of treatment that can solve all the problems. It can't. You have to have a decent embryo, you have to have decent endometrium, and then maybe acupuncture can help those 2 things, work together in concert. So that's the only thing I would add. I hope that's okay, Nathan. It's just I worry when people think there's one magic bullet for everything.
Absolutely.
Okay, cool. We got some other good questions. I think we've had that already. Here's one very specific about needles. So I think this is related to the fact that you said they were single use, but it says here about some needles that were
these are a little different. Let me make sure I got this. I suspect she's talking about intradermal needles. They're basically tiny little needles on a sticker, on a tiny little square sticker, and you put them in the skin, and they can stay there until the sticker loses adhesion. I don't know, usually 3-4 days. And so sometimes acupuncturists will put them on a particular point to go, as it were. I don't know how to call it, but I tried them. Okay, yeah. So those intradermal needles. Sometimes they go in the body. Sometimes they go into the ears. Yeah.
Okay, lovely. That's good to know there are different types of needles. There's another question here from Kaylee. She's having this genetic testing on the eggs. I think she means embryos, which can take up to 6 weeks after retrieval. And I think, because this is my sort of area, 6 weeks to get the results, and then have the embryo available for transfer. So she asks, would I be best to start the acupuncture before the egg retrieval, or do what this talk was about, which is pre and post transfer only?
Let me make sure I'm clear with everything. I've on the eggs, which could take.
I think the key here is, because the IVF cycle is not continuous, like having the egg retrieval and then having the transfer shortly afterwards, it's separated by 6 weeks. So
right.
I guess the question is there a benefit to having something before and after retrieval, and again before and after the transfer?
Yes. I mean, as I mentioned, if I tend to think that doing it before retrieval and before suppression is good, to try and get the cycle as regular as possible. And so there's a good kind of up to ovulation, and then through building of the endometrium and clear shedding, so that all, like every part of that is working nicely, so you can have a good endometrium for implantation. So I mean, I would argue that it's acupuncture is good for all parts of this. But yeah.
Well, okay, let's expand that question. I'm getting the message that you can do quite a lot of acupuncture and it could be giving you benefits throughout the IVF cycle. I mean, I'm not endorsing that. I'm just saying that's what I'm hearing. Is there too much acupuncture you can have?
Too much. I mean,
Like, what if
most
someone said
people wouldn't.
this all sounds good? I could have it here, I could have it here, I could have it here. If it were possible to have it every day, why wouldn't you have it every day?
Right. Yeah, that's a good question. For some conditions, actually, it's more for physical problems. Sometimes it's nice to do it every day. For something that's cyclical like this, I every day might be overkill, and I think it probably would be overkill, just maybe a little too much stimulation.
Okay.
Yeah, I don't have anything to back up why that would be a problem exactly, but it just seems like going in every day, besides even if cost weren't an issue, it seems like that just might be too much. So generally when you're doing, it's like before suppression, or when you're doing it for whether it's IVF or fertility, you're going in twice a week, once a week, but usually twice a week at most.
No, that's great. And I realize these are tricky questions and they're not sort of one size fits all. The reason
Yeah.
I'm asking is because, when I'm doing coaching with patients and talking about various things, in this case, I'm going to say something completely different. Men taking supplements to improve their sperm. They tend to think, as we all do, it's a human nature thing, more is better, rather than moderation or time it properly. And what I'm hearing from you is, it's not all about more. It's about doing it appropriately at the right time with the right cadence. And I think that's an important message. Otherwise, people would say, if this is good, I want as much of it as possible. And
Yeah.
that isn't necessarily good.
Yeah. I mean, Chinese medicine, the whole, I mean, not just with fertility, but it's all about systems and harmony within systems. And yeah, I mean, more is better is an American ethos. But within Chinese medicine, we're trying to, follow the cycle, and more, is not necessarily better.
Perfect. This is a good question from Sandra because it relates, and I think this is, we're getting into safety territory here. It sounds like acupuncture is on the whole very, very safe, but you said during early pregnancy, first trimester, which, the 2-week wait isn't strictly speaking the first trimester if you're not yet pregnant, but we're definitely in that sort of territory. Should you be doing acupuncture, post transfer, in the 2 weeks before you get your pregnancy test result?
It should be safe after a week, but I think 2 weeks is a very reasonable thing to do.
What? So sorry, just to be clear, you're saying get your pregnancy result. If you're pregnant, once you've got that result, it's okay, but you should probably not do it before you get the result.
Sorry, after you get the result, wait a week, but 2 weeks would be good. I mean, if you know you're pregnant, wait a week. But if you wanted to wait 2 weeks, that would work as well.
Okay, but the 2-week wait specifically refers to I've had an embryo transfer and I haven't done my pregnancy test yet. So what about that period where it's obviously a very, well, no, I don't want to say it's a very sensitive time, because the reality is, you can do all kinds of stuff when you conceive naturally, and, it doesn't necessarily have any impact. But should you be doing acupuncture between embryo transfer and doing a pregnancy test? I think that's what that question is asking.
Between that time, I would not.
Okay.
Just to be safe.
That's great. Thank you. Then we got a nice question here about supplements. Now, maybe if I'm not clear what this is asking, maybe Aid can, or Addy, I'm not sure how that's pronounced, can clarify in the chat. But should you stop supplements once stimulation starts? And I'm guessing this means herbal supplements, but I'm not entirely sure because there are other Western supplements, I guess.
Yes, I'm not actually. Yeah, I'm not sure because it could be just a multivitamin, or it could be something. So
Very specific.
that might be more your territory. If you're talking to women and they are taking various Western supplements, you'd probably know more about that than I would. I'm more in the Chinese herbs.
Okay, well, maybe Adi or Aid, I'm not sure how that's pronounced. It maybe if you've got something more specific, we can forward that on to Dr. Yana, on to the Unica Clinic. So here's an interesting one from Emma. So we've talked about, you're talking about doing acupuncture before and after embryo transfer. If it was a donor egg, so you've had no, you haven't produced the egg yourself, would it be any different?
A donor egg. So you're not necessarily doing the.
So you haven't had the stimulation yourself.
Yeah. No retrieval, no stimulation. So
Correct.
it's just implantation.
Yeah.
I mean, I would recommend again acupuncture for a few months to try and get your cycle in sort of tip-top shape, and so that the endometrium is at max thickness and nutrition level.
Okay, perfect. Given that we've talked about lots of different parts of the cycle where you could introduce acupuncture, I guess I think I might know the answer based on what the publications say.
I'm a broken record.
What you currently offer. But if you only had money to do acupuncture, a couple of times, or you only had the opportunity to do it a couple of times as part of your cycle, where would that be? Would that be the embryo transfer? Is that where all the evidence really lies?
That's what's been tested the most. And okay. I would, because that is, I mean, IVF is expensive, but acupuncture and herbs are not cheap. So if you can't spare the extra money, then I would just do it on transfer day.
Okay, perfect. And here's something that completely gobbledygook to me, so I'm sure you'll know the answer to this one. What's the difference between those two acupunctures? Is one of them ear?
That's right.
Okay.
This is different to standard acupuncture. Sorry, I'm.
So this is auricular acupuncture versus.
It's auricular, yeah. So it's ear acupuncture, and it's basically a part of the same system. So it's most acupuncturists, if they do normal acupuncture, they know about auricular acupuncture as well. So there's actually, as a part of the protocol that I use on the day of transfer, I always use auricular acupuncture. So I do 2 points on each ear.
Okay.
And I always incorporate that. So it's basically a part of the same system.
Okay, perfect. So so during a fertility cycle, that would be part of the procedure, doing the auricular. Yeah.
Yes.
This one, well, just say if you're happy to, maybe you're not happy to answer it because it's Western medicine again, and we can pass that one on. If you're on antidepressants, Western medicine, would there be potentially a problem with Chinese herbs? Is that probably a medical question we should forward on?
I don't think there's going to be a reaction with antidepressants, but I mean, is she talking about just antidepressants and Chinese herbs, or is she including the follicle stimulating certain medications such as endorphin?
I guess we should. This is a good one to forward and just say generically, if you're on some medications and you're thinking of taking Chinese herbs, you should discuss that with your physician, right?
Yeah, I would. Yeah, because I think generally Chinese herbs would be okay, but just talk with the acupuncturist you're working with, and don't listen to me on that one, because I don't know what antidepressant you'd be on, and I don't know what herbs.
Okay, and as I said earlier, the general rule of thumb is if you're doing any test, if you're doing a diagnostic test or a procedure that involves some kind of extra medication or some change to the body's endocrine system, and you're on some drugs, you should always speak to the clinician and say, is this likely to be a problem? So we have a test to look at the endometrium, for example, and we really want to know if somebody's on a medication that might affect the endometrium for obvious reasons, because you might get a different result. So
Absolutely.
I think it's a good rule of thumb, if you're on medications, to disclose them all, to make sure that, you know, whatever you're doing is going to work optimally. Here's a good one, and I'm afraid you're going to have to remember some numbers here from some papers. Oh, sorry, wrong one. It was the one with success rates. Let me just go to success rates. Here we go. So based on studies, what kind of percent increase success are we looking at if we do acupuncture before and after transfer in the best case scenario? I mean, is it modest? Is it huge? You know, I think that's the kind of answer people are looking for.
Some of the studies have been significantly different, like, 20%. I see, I kind of feel like a dummy. So this is what happened actually when we did a test a few weeks ago. I'm actually using my wife's computer, and I have a bunch of studies listed, and they would have more of the breakdowns. Some of them have said upwards of 20% or even higher. So I wish I could give you. There's been a lot of studies done, and there's been several meta studies, which would be looking at the overall thrust of the studies. Yeah, I mean, all I can say is there's a range, and the upper part of that range has been 20-25% more likely.
Okay, thanks. And just for, people, I mean, there's people probably from lots of different countries, but if you're in the UK and you're offered something additional to your IVF cycle, and actually just your IVF cycle generally, you should be receiving all that information. If ever you're thinking, I didn't find out the percentage potential increase, then you're not being given information that you should be given. That's not to say it's 100% correct. It's not to say that it's true for you, but that's one of the requirements for a clinic, is to provide you with that sort of information. So they're not just going, it's better, now pay us. It's better by this amount from this study. That's the sort of thing people should be expecting to hear. There's some more questions about supplements, but I think we agreed we're going to pass them on to the clinical team to make sure that we get that absolutely right. I think we've covered pretty much everything, actually. So are there any sort of, any things that, any more questions, if anyone can think of any burning ones? But also to Nathan, is there, what would be the sort of top tips that you would give to people about, what they should be asking, what they should be thinking about if they're considering acupuncture?
If you are interested, I mean, whether it's for IVF or fertility, you could just try it out for back pain or relaxation, just to see if you like the process. If you're going specifically for fertility, you will want to find somebody that focuses on that, because certain acupuncturists, they've probably had some training with it, but it just might not be an interest or specialty of theirs. And there are a lot of acupuncturists that are very qualified. So I'm sure you can, with a search, find somebody in your area that is a qualified acupuncturist that will be able to tell you a lot more. Like I said, particularly with travel to another country, a clinic like Unica, if you're doing it during the process, like you said, Professor, and also I mentioned, there are some great studies, and then there are some studies that say it's sort of benign. But what we definitely know is it relaxes you throughout the whole process. So whether you're doing it months beforehand, it can very much help your stress levels throughout, combined with doing other relaxation techniques and just trying to keep yourself less stressed out. But then also, if you're just doing it on the day of transfer, it can be a very relaxing and just make for a more pleasant transfer day.
Well, that's great. Thanks so much, Nathan. I've certainly learned a lot. And it's a simple technique. I mean, simple technique with thousands of years of tradition, but it's like many things, complex in how you deliver it. And I think that other thing we said earlier, which is, make sure it's being offered by a properly trained person, because that's true of all of the things that we offer within IVF. A good thing that should work doesn't work when it's done improperly. I think that's a fair thing for everyone to remember. Well, we'll close the session there. Thanks so much for everybody's input. Thank you, Nathan, for a great talk. And sorry, Dr. Yana couldn't be here, but obviously we can pass on your questions to her and to the clinic, which leaves me just to do a shameless plug for the next webinar that we have in this series, which is next week. And just by chance, I happen to be presenting.
That handsome devil.
Yeah. A better day for me, I'm afraid. Yeah. And I'm calling it the Alternative Guide to Fertility Coaching. There's a lot of coaching around at the moment, which I'm sure many of the audience today will know about. I would say, based on maybe what you've heard today, I've got a slightly different approach. It's a lot more kind of, ask the difficult questions. That's the way I do it. It's not for everybody, but I'm hoping that you'll come along and tell your friends and see what you might learn about how to approach this really difficult fertility journey that many of you are on. The link, you can go to the website to find out more about that particular session. I think in the chat there's a link to find out about upcoming events and to volunteer if you want to as well. So I think we've probably done everything. The recording was made today, so if you didn't get to see all of it, you can do a catch up. But thanks very much for all of your participation, and hope to see some of you next week.
And thank you, Professor, for all your input. I appreciate it.
Thank you.